In the heart of every community, caring comes naturally. At Ohio Farm Bureau Health Plans, we're your neighbors, your friends, and your partners in health. We believe everyone deserves the very best care tailored to your unique needs. Become a valued member of our family, and we'll take care of you and yours. Together, we care. Together, we grow. Together, we thrive. Ohio Farm Bureau Health Plans. Plan on us. In the heart of every community, caring comes naturally. At Ohio Farm Bureau Health Plans, we're your neighbors, your friends, and your partners in health. We believe everyone deserves the very best care tailored to your unique needs. Become a valued member of our family, and we'll take care of you and yours. Together, we care. Together, we thrive. Ohio Farm Bureau Health Plans. Plan on us. In the heart of every community, caring comes naturally. At Ohio Farm Bureau Health Plans, we're your neighbors, your friends, and your partners in health. We believe everyone deserves the very best care tailored to your unique needs. Become a valued member of our family, and we'll take care of you and yours. Together, we care. Together, we grow. Together, we thrive. Ohio Farm Bureau Health Plans. Plan on us.
Good evening, everyone. Welcome to the second webinar of the Ohio Farm Bureau Health Plans webinars. If you're joining us again, this will be the same content as you heard last month. So this is the second of 3 webinars. So thanks everybody for joining us. My name is Trevor Kirkpatrick. I'm the Director of Health Services for Ohio Farm Bureau. We are very excited to have this new opportunity for Ohioans for Ohio Farm Bureau Health Plans. Just wanted to cover a few things before we do get started with our presentation here today. You will be seeing on our website, ohiofarmbureauhealthplans.org, the umbrella name Healthcare Solutions. So Ohio Farm Bureau Healthcare Solutions houses 2 products. One of which is our small group plan for employers, and business owners. That is a separate product from what we're going to be talking about this evening, but wanted to make you aware that that is still going to stay intact and grow. That is an Anthem network that is for employers and business owners, for employees of groups of 1 to 50. So that's our health benefits plan. Tonight, we're going to strictly focus on the new Ohio Farm Bureau health plans, which is for families and individuals. We're going to have somebody on here from Farm Bureau health plans here in just a moment that I'll introduce to you all to kind of take over and answer some questions. There is at the registration, you should have seen a question submission. We will be going over those questions this evening. There is also the chat feature that you can use to ask some questions if you would prefer to do that. We're not going to be able to hit them all because there is so many great questions, but we will do our best to cover all bases. The question I get a lot is who is this plan for? The new Ohio Farm Bureau health plans, they're for members. And I wanted to take just a moment to describe what a member is. It is not the traditional cows, plows, and sows. If you support our mission of strengthening agriculture and growing our communities, you can be an Ohio Farm Bureau member. So regardless of if you own livestock or not, doesn't matter how many acres you own, if any at all, as long as you support our mission, you can be an Ohio Farm Bureau member. And if you qualify, you can also have Ohio Farm Bureau health plans. We do have a brand new website of ohiofarmbureauhealthplans.org, which we will mention many times throughout this presentation. That is the house of all things information. Both plans are underneath ohiofarmbureauhealthplans.org. A lot of the information we're going over tonight will also be on ohiofarmbureauhealthplans.org. With that, I'm going to introduce to you guys Billy Fields. He is on the State Alliance team there in Farm Bureau Health Plans in Tennessee. He has been doing this for a while with all kinds of different states around the country. So he's a wealth of knowledge, has been my best buddy as we introduce this new plan. So Billy, I'll let you take it from here.
Hey, good evening. Thank you for the kind introduction, Trevor. As Trevor said, my name is Billy Fields, and I am Ohio's primary point of contact for all things Ohio Farm Bureau health plans. We're very excited and proud of the work that Ohio Farm Bureau put into making this happen, hours upon hours of working with your legislation there in Ohio to the governor signing the bill. So that we can also offer your members another option for great affordable health care. I wanted to go through and just kind of give you guys a quick overview of who is Farm Bureau Health Plans and some of the high level of the plans that we offer. And I'm going to share my screen. In hopes that everybody can see it. Okay, are we good to go, Trevor?
Looks good to me.
All right. So who is Farm Bureau Health Plans? So Farm Bureau Health Plans was created here in Tennessee in 1947. So we've been serving the members of the Tennessee Farm Bureau for 78 years now as it comes to affordable health care options. Since the inception of health plans here in Tennessee over the last 5 years, we also have included 10 additional states who have jumped on the bandwagon and wanted to provide their members another option for premier health solutions. To go over what plans that we offer, we do offer 4 what we call traditional plans for our under 65 members. We do offer 2 choice plans. One is our advanced choice plan that has multiple deductibles at $1,500 and at $3,000 per individual. Also offer our classic choice plan, which is the individual only plan with deductibles of $3,000 and $6,000. We do offer options for high deductible health plans. You can see the deductibles are $2,250 or $3,750 per individual, or $4,500 and $7,500 per family. And our major medical plan. This is where you would typically see the lowest premium rates that we offer. It's the $7,500 per individual. All of our health plans are utilized through United Healthcare's Choice Plus Medical Network, which is the largest network in the United States. UMR is our third-party administrator for these plans. All these plans are processed through UMR, which is again owned by United Healthcare. And our pharmacy benefit manager is OptumRx. This is the network, the pharmacy network that is provided for Ohio Farm Bureau members. And all of our dental is through Delta Dental, and our vision is through VSP. Going over a quick network comparison, you can see here at this chart of Ohio how we compare against the Blue Cross Blue Shield Advantage plan in Ohio. The areas you can see tinted in green, or the greenish shade, is where United Healthcare actually holds the advantage over the Blue Cross Blue Shield network. So this guy should make you feel comfortable with the amount of coverage that you receive there in Ohio. Going over, look down just a little bit, the network comparison as it comes to the individuals. You can see for our Choice Plus plans that we have approximately 1,700 more individual facilities included in our plan. With the hospitals, we have 3 more than than Blue Cross Blue Shield. For your primary care physicians, you can see there's about, we'll say 700 more primary care providers provided our network versus Blue Cross Blue Shield. And with the specialists, it looks like there's about 1,200 more specialists covered underneath the United Healthcare Choice Plan. So again, that's just a high-level overview of the different plans that we offer, along with our bundled dental and vision plan. As I said earlier, our dental and vision plans are through Delta Dental, and our vision is through VSP.
Hey, Billy, hate to interrupt you. It looks like your screen stopped sharing for some reason. Didn't know if that was intentional or not.
Yeah, that was the last slide on there.
Okay,
Trevor.
very good.
Absolutely. Yeah, so with that said, I will turn it back over to you, Trevor.
Yeah, sorry, I cut you off there.
No worries.
I didn't know if that was the end or not. So some of you said that the screen was small, and we've got a lot of people on here, so of course it'll jam it up a little bit. Everything that was shown on there, specifically the plan comparison, is on Ohio Farm Bureau healthplans.org. On the forms section at the top of the website, you will be able to download that yourself, look through it, print it off, and mill it over as you wish. So all of that information is available on ohiofarmbureauhealthplans.org. So we've got a lot of questions that were submitted previously that we'll go through, and we will do our best to go through all of which. So again, we're really excited to have these 4 plans. And we'll answer any specific questions that we might have. None of these are in specific order. We're going to kind of answer them as we see them on our question sheet. So we'll kind of bounce back and forth. But if you do have a specific question, feel free to pop it in the chat, and I'll monitor that as closely as possible. So Billy, we'll get started with some of the questions that are asked. Are the GLP-1s, like Ozempic and others, covered by these plans and insurance? And does weight loss reduce the cost of premiums?
Yeah, so for the purpose of weight loss, GLP-1s are not covered. The second part of the question, does weight loss reduce the cost of premiums, is if you do have a change in your medical status once you're enrolled in our plans, we have what you can submit. It's called a reconsideration of rate form. This form can be completed by your doctor, and if you have for an example of weight loss, if you do have a significant change in your health status, you're more than welcome to submit that reconsideration form and have your rates reviewed for adjustment.
Very good. What's this going to cost these folks? That's the big question I get a lot. What's the cost of Ohio Farm Bureau health plans?
Yeah, so great question. So what we typically see that our plans, right as we sit right now, are 30 to 40% cheaper on average than what you'll see out there on the ACA plans. There's a possibility that this spread could become even greater, as you guys, I'm sure, are aware, if the ACA subsidies aren't extended. So yes, very affordable, much cheaper when it comes to relations to what's out there on the ACA, Trevor.
When it comes to those costs, what factors go into seeing what that cost might be monthly for the individual?
Yeah, another great question. So when you complete your application, we have a series of medical history questions that we require our members to answer for us. Based off of those answers that you provide through our underwriting department, it is determined based off of your health what your monthly premium would be for you and or for your family.
Very good. What plans are offered for those who have diabetes?
Another great question. So, like I just said, in our applications, there are a series of medical history questions that each applicant will be required to answer. Diabetes, unfortunately, is one of the questions that we consider one of our quote unquote knockout questions, Trevor. So, currently, we do not have any plans for those who currently have diabetes prior to enrolling in our plans. However, that does say that if you are diagnosed with diabetes after you are enrolled in our plan, we do provide complete and full coverage with that medical diagnosis.
Got it. Who qualifies for Ohio Farm Bureau health plans?
Everybody does who's a member of the Ohio Farm Bureau. So I think it's a very simple process where you can enroll with the Ohio Farm Bureau on the Ohio Farm Bureau Health Plans.org website or through the FBF website that you guys have. So the only requirement is you must be a member of Ohio Farm Bureau.
Very good. Is there a lifetime limit or payout on the health plans?
Good question, and the simple answer is no.
Very good. Let's see. Let's talk maternity and pregnancy. Do these plans cover maternity? And to go into a little detail there.
Yeah, absolutely. And sorry, I was looking at the questions coming through as well. So our plans do, as long as you're on one of our family plans, which is our advanced choice plans, high deductible health plans, and major medical plans, maternity care is provided as long as you've been enrolled for 9 months.
Okay, very good. If this is not insurance, as we've said before, then what is it? These plans are not insurance, then what is it?
Whoever submitted this question is on it, Trevor. That is a great question. I think it's very telling that you can see our name is Ohio Farm Bureau Health Plans, not Ohio Farm Bureau Health Insurance. So the big difference is that well, first of all, these plans are what we say, the functional equivalent to traditional health insurance plans. Looks like it, feels like it, acts like it. The primary difference between our plans and what you see out there through traditional providers is that we do underwrite these plans. And at times, members can be denied based off of their medical history. So, unfortunately, we do have to say no to just a few so that we can say yes to many more and do our best to make those rates much more affordable than you can get elsewhere.
Very good. So on that same kind of question, talk about pre-existing conditions. There's a lot of talk among the individuals about what those are. Is it 6 months? Is it 12 months? What are pre-existing conditions?
Yeah, so let's start off with the time frame. So with our two choice plans, our advanced choice and our classic choice plans, those pre-existing waiting periods are 6 months. Through our high deductible health plan and through our major medical plan, those pre-existing waiting periods are 12 months. So I will try to define a pre-existing condition for you guys the best that I can. So this is defined as an illness, let's say an injury, even pregnancy or other medical conditions which existed at the time preceding to the effective date of your contract. So any condition that you had prior to enrolling in our plans, it can be for medical advice, was treatment or recommended, received from, provided healthcare services for. Any condition that you have prior to enrolling into health plans would be considered a pre-existing condition, Trevor.
Very good. Let's talk a little bit about network. How do these individuals determine who is in out of network and if these plans are offered in the facilities and the providers that they might already use?
Yeah, another good question, and it's a very simple process. You go to United Healthcare website, you look up our plan and see a list of providers, and you can see if your doctor is part of the network or not. Uh, Again, kind of going back to this PowerPoint we looked at just a few minutes ago, with a large number of local providers, we do see the majority of most providers are included within the network. So that's what my first recommendation would be. If you have questions of if your doctor is covered, feel free to go to the website and you can check it out.
And I do believe maybe I'll even do a walkthrough if we have time at the end. We have a UMR link on Ohio Farm Bureau healthplans.org that you can also use to see who's in and out of network. Let's see here. Maybe more information about the pre-enrollment physical exam, the eligibility that might be required there. Is it at the time of application? Is it after? How does that work?
Yeah, so this is required at the time of application. So for all of our members who are 40 or older, or dependents who are 25 months or younger, medical records are required once the application begins. The medical records that we need will be typically the height, weight, blood pressure, fasting lipid panel, fasting glucose, and a pharmacy printout for all your pharmacy records for the last 12 months.
Got it. Still see a lot of questions about the cost and the premium, which is obviously a very, very interesting question for a lot of folks. But let's talk about how often those premium rates changed for an enrolled member. Is it annually? And when is that increase anticipated?
Yeah, so premium rates are typically reviewed on a yearly basis. Any increase that we did have would be at the beginning of the calendar year. The best part about it is these premium rates are measured on a state level, not a national level. So it is all based off the trending claims history in Ohio only.
Gotcha. I see here another, is there an online system that they can log into to view these benefits? Going back to our website, that's be the best place to start, but is there any more insight on where they can log in to see these scheduled benefits?
Yeah, your website is the best part. At the very top, you have a forms tab that you can click on, drop down, and it'll have the schedule of benefits for our four traditional plans and for our Delta dental plans.
Very good. Okay, so a couple of questions about application and that process. I'll go out and say that there's three ways you can do that. Certified agents all across the state. There's a call center number, and you can do it yourself. But as they go to do that, can they apply for multiple plans? Do they have to do one at a time? Maybe a little bit about that process.
Yeah, sure. So you are able to receive a quote, a general quote, without knowing any of your medical history very early on in the process. That doesn't require a membership through Ohio Farm Bureau, but you can do it online yourself at Ohio Farm Bureau's healthplans.org, or you can work with one of your local agents who will be able to provide you that quote as well. When you do go through the final application process after your medical records and you'll get your exact premium rates. That's typically for one plan at a time. If those rates come in a little bit higher than what you're anticipating, you can make a request to have rates submitted over to you for our three remaining plans.
Very good. Now we do have dental and vision that's not underwritten for anybody of any age. Can they do dental without the vision, or are they always booked together?
It's always booked together. We always say we throw the vision in for free.
There you go. Very good. I see a member here, or a membership question. I'm a member, but my spouse is not. Can my spouse get a plan without me getting one? Great thing about Ohio Farm Bureau membership is it is by household. For those 18 and under and your spouse are all underneath one membership. So that yearly membership is wrapped up between you and your spouse. So you should be covered there. if you select one plan and later want to change to a different plan, do you have to go through the underwriting process again?
Yeah, so depending on which plan you are, if you are wanting to go to a more comprehensive plan with more coverage, typically you would go through the underwriting process again.
Very good. Specific question here about the high deductible plan, which is HSA qualified. And
Correct.
the major medical plan said that the routine physical exam is not a covered benefit. Does that mean it will just be treated like any other office visit for the 80/20 deductible split, or is that isn't covered towards the deductible?
Yeah, so for the HDHP or high deductible plan and for the major medical plan, that would be treated like any office visit with the 80/20 deductible.
Very good. Another specific question about HSA. Can I use my HSA or my benefits for OPERS to pay for my plan?
Yes, our high deductible plan does qualify as the HSA.
Very good. Couple more questions here. I see that several repeats. Is it possible to submit an application before payment info, meaning membership, before deciding which plan to use?
Yeah, good question. And part of the legislation that was written written for you guys this year. So legally, you must be a member of Ohio Farm Bureau to submit an application at this time.
Okay. Maybe shed some light on a lot of underwriting questions here, but how that process work, what medical history we've touched a little bit on, but how long does that take, and what does that underwriting process look like?
Yeah, so as you fill out your applications, we talked about earlier, there are medical questions that you do have to answer. If you answer yes to any of the questions, that will trigger our underwriting department to request medical records that you can get typically from your primary provider. If we receive all the information that we need at once, and remember, we talked about if you're over 40 or you have a child under 25 months, it's good to go ahead and have those medical records ready, Trevor, so that you can submit them upon your application. If you have what we call a clean application, which means you provide everything to us at the beginning, we'll typically see a turnaround time within 3 to 5 days through our underwriting department.
Good. I'm going to give a quick live demo here for those who can see my computer, and I'll do my best for those who might be on the phone. But this is ohiofarmbureauhealthplans.org, and on the home screen, there is a tab at the top labeled Find an Agent. This is one of my favorite pages on our website. It's mapped out for all of our certified agents. It is updated every time I get a certified agent, and it is immediately. You can put in your zip code and see which of these agents is nearest you, which is one of the ways you can start applying. I saw several questions on how do I start applying. Obviously, you can call any of our certified agents. At the very top of this website, there is quote and apply. Once you click that, you'll come with our two different plans. You'll click the health plans, request a quote, and that will start your process and go to the portal there. And whether you're searching for medical or dental vision, you can start that process yourself. And then the last thing I'll mention is on all of our health plan pages, specific to health plans, at the very bottom is the call center number. This is a great set of agents that are very knowledgeable about all these. That phone number for those listening is 833-468-4280. This page also has every single plan specific schedule of benefits. One of the other things is the online portal. So if you wanted to see who's in and out of network, use the UMR website. It also has all of the other value adds, different types of portals that might be listed. Billy mentioned earlier at the top here, under forms, there is a claims form, coverage information, forms to use with a new application. This is all downloadable that you can use at your own leisure. Quick question here that came in. What age will my child come off of the plan? My insurance companies carry the child until age 27. What do these plans do?
Yeah, so Trevor, I think you said earlier, one, you must have your own membership when you turn 18, and then 25, the child would roll off the plan.
Okay, very good. Do these plans meet minimum essential coverage standards?
Yeah, wonderful question. And the short answer is no, they do not meet the minimal essential standards because we are considered health care, not health insurance, like we talked about earlier. The difference being that we do underwrite, and because we underwrite, and this is only available for Ohio Farm Bureau members, it does not qualify as essential care. The great news is that the tax penalty is $0 currently. So you are penalized for enrolling in our plans.
Okay, good to know. If I'm on several prescriptions, do those consider pre-existing conditions?
For the time, if you were under the pre-existing condition waiting period, that would be considered under the pre-existing conditions.
Okay. Looking like several different questions there we've answered. So I believe that is all we've got for this evening. Billy, I appreciate you jumping on again and providing all the knowledge and input. Folks that are listening, we are having our third and final webinar. It's the exact same content on November 25th at 6 p.m. If you would like to rejoin, you're more than welcome to. And as always, go to our website, ohiofarmbureauhealthplans.org. There's a call us and about us section at the top. That'll go directly to me. So if you have any specific questions or any other details, be happy to provide you more information there as well. So I appreciate all of you attending this evening. Please feel free to reach out with any other questions you might have through the website, and we look forward to serving you one step further. Have a good evening, everyone.
Thank you.